Hi and welcome to this video about scar tissue remediation and scar tissue massage. I'm super excited to finally be making this video because it helped me so much in my own healing journey to do this type of treatment, and both receiving it from a practitioner and doing it on myself. So in this video, I will share firstly my story, how I found this technique and how it helped me. And then we're gonna listen to the expert, the queen of scar tissue remediation, the founder actually, Dr. Ellen Heed, and she will speak more about scars and how you can identify scars and why it's important. And then finally, we're going to go more into what can you do at home, like how to do this safely and in the most effective way for you. I just want to share, before I share my own story, why I'm so passionate about this subject, not only because it helped me so much, but actually scars and scar tissue are quite overlooked, especially regarding to birth injuries. So most medical healthcare professionals, they don't know much about scar tissue and how it can actually affect the pelvic floor and the vagina. Scar tissues are very, very common if you have given birth. 87% of all women who gives birth have some kind of tearing and therefore some kind of scarring. And this will affect all the tissue inside the vagina and in the pelvic floor. And for some women, they won't notice it, but for some women, they will notice it further on, like closer to menopause, for example, when hormones starts to shift differently, the tissue will also shift and the scars will be more noticeable in sense of, for example, you can have symptoms like incontinence or prolapse or pain or heaviness. What's really important to understand is that if you give a scar what it needs, it will dissolve. That's a favorite quote from one of my teachers. I love that. And we need to work on scars from different angles. And scar tissue remediation is one fantastic tool. So that's what we're going to speak about today. But just remember that there might be other angles that you need to tackle to dissolve your scars. Okay, so I'll start with sharing my story. As most of you know by now, I had birth injuries when I gave birth to my first son. And all this escalated a lot for me when I gave birth to my second son and had a very symptomatic prolapse. And that's when I decided to, okay, I can't live like this. Like, I need to do something. And I did so much research online, and it took a few months before I found, I think actually it was this podcast that we're going to listen to today with Kimberly Ann Johnson and Dr. Ellen Heed. And they were saying so many things about pelvic floor health and vaginal health. And, you know, it was just music to my ears. Suddenly, it was like someone laid a puzzle in front of me, and I could see the pieces and how it all fits together and how we actually can heal this. So in this podcast, they mention scar tissue remediation, not as a very big part, but after listening to this podcast, I started to do more research and read on Dr. Ellen Heed's website about scar tissue remediation. I'm going to link to it below so you can also read about it. So from what I understood before I had even tried it, was that it was hands-on, hands-in work. So someone is a practitioner, of course, is going to work with your pelvis and pelvic floor and vagina with their hands to dissolve scars, to give pressure onto the scars to make them dissolve, in combination with using castor oil, which is magic. So, but not only that, because if it was only the pressure, only the oil, that could be massage, right? And that's a great beginning. And if you're going to do this on yourself, it's probably going to be more like a scar tissue massage, because scar tissue remediation is very advanced and really hard to do on yourself. Trust me, I've tried it on myself. But who knows, maybe it will work out for you. So anyway, I was just super curious on doing this, go to a practitioner and experience scar tissue remediation. I live in Sweden and Dr. Ellen Heed lives in LA, and Corona had just, popped up in this world. So, but I was like, I just need to meet her. There's no practitioner in Sweden, and I really, really want to try this. So I emailed her, and yeah, she was like, yeah, you can come here. We can do it really intensively for like 5 days, because I had 2 small kids at home. I didn't want to be away from home for too long. But then she wrote to me one day that actually my friend and colleague is going to Sweden. This was really good news for me. I didn't have to go to LA. I could stay in Sweden and still do the sessions. So I went to see Jeannie, who is an amazing practitioner, and she has a background in Chinese medicine, and she has so much knowledge about the body, and it's really a full body approach. So we started with having a conversation and me telling more about my symptoms and the history, physical, mentally, and all of that. And she took a look at my posture, everything. Once we were going to do the scar tissue remediation, I was on a bench, and I had my legs on top of her legs. So she was sitting at the bench, and my thighs were on her thighs. And it was so different and very nice, I think. I have never liked going to a gynecologist. I don't feel comfortable at all in that type of chair. So having like body contact with her felt so good and very safe. And she started to, taking her hands on my thighs and on the top of my pelvis, around the pubic bone. And once she started to like work with the pressure and also with communication, because that's a lot what the scar tissue remediation is about. So she started using castor oil, and she was always explaining exactly what she was doing. She was asking me if it's, painful or too hard, or if she found like a knot or something. She was asking about that. And slowly she worked her way downwards and inwards. And I felt completely safe all the time. It's a lot about hand holding and guiding into the experience. And once she started to work vaginally, so internally, she started to identify the different scars I had inside, and I could start to sense them from within. So I could feel when she was putting pressure at some points that I couldn't feel anything. I was completely numb. And if she took like some harder pressure, I could sometimes feel pain, that it was painful, but also if she stayed there, that it actually did resolve. And for the first session, this was mostly what we did. The second session was much more intense emotionally, because then I knew more what this whole thing was about. And she could, I think, go deeper, both physically, like maybe not hard, putting a lot of pressure, but more challenging, in a more challenging way. And lots of things came up. She started to ask more about different experiences of my life that could potentially be connected to the scar tissue. and I was crying a lot. And we're going to hear Dr. Ellen Heed talk more about different types of scars, that there are, the physical type of scars, the actual tearing, but also the more emotional ones. So emotions can actually make our scars grow or stick. I did in total 4 sessions with Jeannie. It was 2.5 hours each, and it gave me so much. And it had different types of releases every time, but the emotional part was so powerful when I got to that point that I could relate a scar with an emotion. And I did the 4 sessions. And after that, I felt that I need to implement this into my routine. So I'm going to talk more about how I did it and what I've done, like for myself, for my own self-care routine with this. But first, I would like you to listen to Ellen Heed when she talks about the scars and how to kind of identify scars, because I think that's the tricky part in the beginning when you start to work with this.
You can feel the difference between emotional tension. It feels different. It feels like the tissue retracts automatically away from your fingertips, like it jumps away, which is different than biomechanical tension, where it's just kind of tight. And the person may be going, that's sensitive, but the tissue itself isn't jumping away from your fingertips. Biochemical tension, or an imbalanced global biochemistry, is like putting your hands in a fudgy kind of Play-Doh, where the tissue is really passive, and you put your fingers in and there's no resilience. It doesn't push you out again. Healthy tissue, you put your fingers in and it pushes you out at about the rate that you're pressing into it. But if your fingers sink in like to fudge or Play-Doh, that's a biochemistry problem, and it's going to feel bruisy when you touch the person. And scars have a very distinct feeling about them. If you're feeling healthy tissue, it's like running your hand along silky fabric. But if you've ever felt the bumpily roughness of raw silk or sandpaper, scars feel like that. They feel unpredictably tough and bumpy compared to the feel of the other tissues around them. You can feel the tight, dry, sticky adhesions between otherwise muscle fibers that would otherwise kind of roll apart to your inquiring fingers like a hot knife through butter. When you get to a lump or a bump or a dryness or a roughness, sometimes that's what scar tissue feels like. So you can learn to get that kind of palpatory sensitivity over time with practice and good guidance.
I just think it's so fascinating how much you can know about scars, and actually, to heal scars, that is what we need more of. If you want to try this at home, or at least start with some scar tissue massage, you will need some castor oil. So choose organic, buy a big bottle. So you need that. You need some kind of something to have underneath your butt, because castor oil is really messy. Like, it's very thick and sticks to everything. So preferably something with like plastic on one side and really soft on the other side. Or if you're still changing diapers on your baby, you could use like what you have underneath when you change the diaper. So that could work too, and you can just throw it off if it's a one-time thing. I use this, and I wash it and use it again. And the last thing you need is some toilet paper, because it's going to be a mess afterwards. And if you want to use your hands, you will need to take the oil off your hands. So what you do is you put a pillow underneath your hips, and you cover the pillow with your cover. Uh, you lay your hips on the pillow so that the hips are elevated, because this is going to help bring the castor oil inside and all the way in. And you slowly work on yourself. So I would really recommend starting on the outside, like around the pubic area and maybe the low belly, and around the front of the pelvis. And then you go into like the inner labia and the outer labia if you want to, around the vaginal opening, the perineum, which is the part between like the vagina and the anus, and also around the anus, especially if you have any types of hemorrhoids or any pain, fecal incontinence. You work around your anus and maybe a little bit inside if it feels okay. And then you always keep adding the castor oil. So more and more castor oil. It's going to be like a castor oil bath underneath you. And then you go inside and you keep taking castor oil on your fingers, and you slowly, like the first time, you just want to spend like 10 minutes and just start to map out in your vagina. Where are the different parts? Are you able to feel or identify any type of scar tissue, or maybe not? And maybe, like for me, I felt depressed by just doing this, because I was like, it's not at all like before I had kids. I just miss my old vagina, and it brought up so many sorrows for me. So I had to keep it very uh, short and gentle. And I put on some music to kind of half distract me, because it was too much to just kind of feel my vagina. And then, as you do this, I've done it once a week during my healing journey. I started to slowly add on. So I started with 10 minutes per week, and then 15 minutes, and then 20 minutes, all the way up to 30, sometimes 40 minutes. And I could be more and more present with myself. So now when I do it, it's really like a self-care activity. I lit some candles, I put on some nice music, and just make it like a really nice moment for myself. In the beginning, I was more like, I actually think like one of the first times I watched something on YouTube the same time I was doing it, because I just felt it was so hard, feeling myself internally this way after everything that I've been through since giving birth. So just ask yourself what you need to be able to make this happen once a week. The castor oil itself will be so amazing on the scars. The scars really absorbs the castor oil, and it helps them dissolve so beautifully. And if you find spots that are hurting, you might want to stay there, give a little extra pressure or movement with your hand. And maybe you can also start to try exploring scar tissue remediation. So that's kind of the extra layer with the emotional processing. If you find scars that you believe hold emotions, stuck emotions, try and see what comes up for you. And if you cry, cry. Just cry it out. And if you laugh, you laugh. I was so far from laughing, so I can't even imagine anyone would laugh, but maybe you will. And if you just kind of feel numb, you feel numb. Anything is fine. Any kind of emotion that comes up, you try to acknowledge that emotion. That's a really, really important part. But that's kind of when you are used to doing the massage, you can start to observe your emotions too. So you go gradually, you start with the massage, and then, when you feel you can more and more be present in the moment, and, just closing your eyes, doing this almost like a meditation, being very observant what happens inside of you. So that's when the interesting part can happen. And if you do find a practitioner somewhere close to you, I really, really recommend going to a scar tissue remediation practitioner, or something that is called de-armoring. It's working much more on the whole body, but also like with internally in the vagina. So yeah, I would really recommend you to have like a guide holding your hand on this path, but it's a great start and very cheap and very effective way to do this on yourself. I'm just going to mention lastly another tool that you can use, especially if you don't have long fingers as I do. It might be good to use a wand. You can buy wands like these. As you can see, it's very long, so you can reach far up. And especially if you know you have scar tissues, maybe around the cervix, and if it's slightly higher up inside, you probably you can find the ones with some structure that can loosen up the scars in a different way than your fingers. So I personally don't prefer this. I use it sometimes, but I really prefer to use my fingers, because then I can really sense in my fingertips what is going on. So I can sense it both from my hands perspective and from my inside perspective. So that's it for the scar tissue remediation. Just want to summarize that if you want to try this, I suggest at least for half a year, 6 months, you spend 1 time per week. And I don't do it when I menstruate. I don't believe we should put things in our vagina when we menstruate. So you can just leave her. Otherwise, you do it once a week. So it's kind of 3 times per month, sometimes 4. For 6 months, you start with 10 minutes per week, and when you feel ready, you increase it all the way up to 30 minutes. Also, I just want to mention that once you are done, before you take the paper and take all the oil off, you can stay for like 10 minutes just to let the castor oil really sink into the skin and the scars and the fascia. So you stay there and don't wipe all the oil off your vulva, like the outside of your vagina. Try to save as much as you can. And if possible, you do all of this before you go to bed, before you go to sleep, so that the body can continue to absorb it during your sleep. Good luck, everyone who wants to try this, and let me know if you have any questions or how it goes for you.